Hi, everybody. Roberta Heel here for NPGI. Don't forget to subscribe so you don't miss any of our videos. Okay, today we're going to talk about learning plans. Now, if you're a nurse practitioner or a nursing student, you're dealing with learning plans a lot. Now, what I've noticed is that students don't know how to write learning plans. Often students are lost. So I find too that clinical preceptors sometimes aren't sure about learning plans either. So I have my own approach to them that I'm going to give to you today, and then maybe give you some ideas about how to create better, more efficient, and more effective learning plans moving forward. Okay, so the first thing that tends to happen is that most programs have a template that students will complete in order to create the learning plan that they want. So let me start by showing you a sample learning plan template, which I've just put on the screen. Now, they all tend to have similar types of formats or columns. So they all want to know what the learning objectives of the student are. They may have something about the course outcomes. They may ask about tools and resources that you'll use in order to achieve those, the date that maybe you demonstrated those, what is the evidence to show that you have completed the objective. Now, this is where students get stumped. For example, I often find them being very, very generalized, like, oh, I want to know how to care for children, or I want to know how to do a cardiac assessment. Although that may be their focus and they're interested, it's important for the student to understand that they need to make the learning plan work for them. And the best way that I've found to do that is to start with the final evaluation. So here are some final evaluations, not the entire final evaluation for the entire clinical placement for one program, and I've edited it a little bit. But it gives you an idea of what the students are required to do in order to pass. And I think that's where they need to start if you're going to do a learning plan. So, for example, integrate advanced physical assessment skills within a focused and comprehensive assessment for the adult client. And then they have criteria. And then collaborate and consult with members of the healthcare team. I think it's really important to create objectives in your learning plan that match these criteria for evaluation in the final evaluation. This is one of the best ways for you to objectively measure that you have met the criteria for the evaluation. And that's the goal, to pass. So if we go back here, so let me see, integrating advanced physical assessment skills and collaborating consulting with members of the healthcare team. Let's now look at the learning objectives. So 1, the next phase, though, if you're going to say, I want to do a physical assessment, I want you to demonstrate that I have advanced physical assessment skills. It's important now to start talking to your preceptor, and for the preceptor to understand that these are the criteria that the student needs to meet. The student is going to create learning objectives that match those criteria for the evaluation to make the preceptor's life a lot easier too, but that it's going to be helpful because they have to be specific. So this is where the preceptor can be very, very handy. The student should chat with the preceptor and say, I'm interested in doing advanced health assessment to meet this criteria. I'm interested in doing a knee assessment. So do you have knee assessments available? Is that often an issue that comes up often in your clinical practice? Depending on what they say, you add it in. So something like this. Okay, we fast forwarded a tiny bit because I wanted to not waste your time while I type this out. This is not a perfect learning objective, but what it does show is that it's smart. It's specific. I will complete at least 2 comprehensive knee assessments, measurable, 2 assessments, assignable, meaning who will do it, the student, realistic, it can be achieved. You've confirmed that with the preceptor, and time related by the end of the clinical rotation. So yeah, you might have to finesse them a little bit, but that is what is expected there. So then the next thing could be, does it match the course outcomes? Well, check your course outcomes and see if it does. Tools and resources. Again, students just tend to list all of their textbooks and stuff related to the course. That's not as helpful. And I think this is where the preceptor can come in handy as well. So for example, if the preceptor knows of a tool, a special tool or a special guideline for a specific objective, then this is where they can help. The date demonstrated, well, that makes sense, and evidence of completion. Again, working with the preceptor, when the preceptor knows that the student wants to do this type of assessment, for example, that preceptor can then look for opportunities for the student to be able to do that. And then debriefing at the end of the day, talk about how well the student accomplished it and evidence of completion. Make sure that the student understands where they maybe can improve and what they did very well. So those are really, really helpful. And then this is a log that you keep, and the student should complete it at the end of every clinical day, so that when the midterm comes along and the final comes along, there's a clear path that the student has met these criteria for evaluation in at least one category. And of course, there will be many, many or more opportunities, but this is a really helpful tool if used in this way. Okay, so that's it for the summary for a learning plan. And it's quick, but I hope it gave you some ideas about how you can use the learning plan to your own advantage, to use to demonstrate that you have met the criteria for evaluation. And at the same time, collaborate with the preceptor and your course professor so that you are taking advantage of all the best opportunities within your clinical placement. Now, I have a little surprise for you. I chose the knee assessment for a reason, because on the website, Nurse Practitioner Global Initiatives, you can purchase a card that has a summary of the knee assessment in family practice, as well as a link to a video. So check it out today.